Hi, welcome back to the channel. It's nice to see you again here. Today we're going to talk about something that's a very common theme. I get asked questions about this all the time from patients. It's also very controversial, so you may hear different things from different people. So I'm going to give you my opinion on this, and we're talking about PRP, or Platelet Rich Plasma. Stay tuned and let's talk about that. By the way, before I forget, like I always do, if you like the videos that we're putting together, click the like button. It'll help us put this in front of more people. And if you would be kind enough to subscribe to the channel, if you're interested in learning about hair loss and hair transplantation, subscribe to the channel so you can get the content that we put in about every week. Okay, so let's go ahead and talk about PRP. So every day almost, I get patients that come to me and say, hey, Dr. Barusco, do you do PRP? I was recommended PRP by so-and-so, and so what do you think about that? Or I have patients that have had treatments with PRP, and either they love it or they hate it. It's very polarizing, I find. So I'll give you my opinion, which is based on, of course, science, you know. It is an educated opinion, let's put it this way. And it may be controversial. I have very experienced hair transplant surgeons that are friends of mine all over the world that love PRP. They do it all the time for their patients. They get good results from it. At the same time, I have people that I know, including myself, that not very crazy about PRP. So these are more personal opinions, okay? Don't hold them against me. Or if you have to hold them against somebody, hold them against me and not everybody else. But so we'll start with this. What is PRP, right? PRP is basically, the definition is platelet rich plasma. If you break down that name, it means that you have plasma that is rich in platelets, right? So that seems obvious, but what does that mean really in reality if you're not in the medical field? So if you look at your peripheral blood, the blood that runs in the veins there, or arteries, you have basically a few components, right? You have the red blood cells, which carry oxygen to the tissues, gives that red color to the blood. You have white blood cells which fight infection. So when you have a cold or anything like that, these white blood cells, many types of them, will go to action and fight the infection. And you have platelets, which are little tiny cells that are responsible for blood clotting. So when you have an injury, when you have a cut or whatever, that blood vessel will break and then the platelets will be activated. There's a very complicated physiological mechanism there that's way beyond the talk here. But anyway, these platelets will sense that there was some trauma. They will go to that area and they'll form a clot, right? So they'll aggregate, they'll get together and they'll form the clot. Not only their action doesn't stop there. We know now from a lot of science that once the platelets have been recruited to that trauma site, they actually start to conduct. Is like a music conductor, you know. They start to actually release all these growth factors. There are hundreds of them, perhaps even thousands. And each of those growth factors will actually have an action, and they will actually promote different things in the healing. So some will recruit the white blood cells because there might be infection there, so they can fight the infection. Some other ones will control the collagen production. Some other ones will control the reformation of that vessel, or the healing of that vessel wall. So anyway, there's a lot of these growth factors. So what we do, the idea behind PRP, which is not new by the way, PRP has been used for many years for different things and very effective sometimes for, you know, for joint pain. People inject PRP in their knees, their shoulders, their backs, and with various degrees of success as well. I don't do PRP for these things, so I'm not going to talk about that here. But for hair loss, the idea was, okay, so if we can get the blood right from the vein with all these things, and if we can eliminate all the red blood cells or most of the red blood cells, most of the white blood cells, and we can just concentrate the platelets, we can use them to promote healing, right? So all these growth factors that the platelets carry in them, we can use them to promote healing. And that's the idea of using PRP for anything really, for a damaged knee, damaged shoulder, back pain, your facial rejuvenation, get your skin younger, and for hair loss too. So what happens when you get rid of all these other cells in the blood. Of course, I forgot to mention when we talk about the elements of the blood, the liquid portion, the fluid portion is the plasma. So it's not water, it's a liquid that's kind of yellowish in color, and so that's what moves the blood. That's where all these cells are, diluted in. So what we do is we get blood, and then we concentrate all these cells in the platelets into a smaller volume. So this graphic here just shows roughly what we do. So in the peripheral blood, the blood that we have right now in our bodies, you have about 95% red blood cells. That's why the blood is red, right? Because a lot of that is red blood cells. You have about 6% platelets, very small amount, and you have about 1% white blood cells. Of course, that's in a natural situation. If you have an infection, this proportion will increase because your white blood cells will be produced more to fight that infection. But in a normal, healthy person, that's about what you see, of course, with individual variability. But what we do is when we concentrate the blood and we do the PRP process, we end up with something more like this. So you have about 94% platelets, about 5% red blood cells, and still the same 1% of white blood cells. Now, there are ways for you to decrease these two numbers even more. Sometimes it's not interesting for us to have red blood cells and white blood cells in the platelet-rich plasma mixture. Sometimes we want to have just platelets. Red blood cells and white blood cells, they can trigger some inflammatory responses in the area where you place them. Sometimes that's desired, sometimes it's not. In my opinion, for hair loss, we don't want to create inflammation, we want to decrease inflammation. So I try to get my PRPs very, very pure, meaning little red blood cells, little white blood cells, mostly platelets. So this is just a picture of this is a very tiny example of all the growth factors that are in platelets. So think of the platelet as a vessel, as a container, right, with all these growth factors inside of it. When there's an injury, these platelets will burst open and they will release all these growth factors, which then will go to work. Growth factors are basically proteins that can be used to manage all these processes. So when we do PRP, so you come to my office, let's do a PRP. So how does the process work? So I'll get you in the room, I'll draw some blood from your arm, right, like you're doing a blood draw for blood test, whatever, and then we will put the blood into a tube system. I happen to use this one here. I'm not gonna go over brands, that's not important. Nobody's sponsoring this video, so whatever. And so there's different systems, we'll talk about that in a little bit, why that's important. But anyway, the system that I have here, I will draw some blood, a certain volume. We will put it in what we call a centrifuge. So it's a machine that spins at high speed, and that spinning will draw the cells all the way to the bottom of the tube, right? So that's what you see here. This has already been spun, has been centrifuged. So yellow part is the plasma, okay, where all the platelets are still under suspension. You see the bottom, that crimson rich red color, those are the red blood cells. And I don't know if the video can show, but there's a little film right on top here of the red blood cells. It's a white film, and those are the white blood cells. Okay, so you have red blood cells, white blood cells, and then plasma with platelets on top. What we want to do is we want to use all the plasma, but none of this darker area below. So I put a syringe up here and I start to pull, and you can see how there's a little funnel up here almost, and that funnel will go down, down, down as I pull, and then eventually I'll see that I'm getting close to the red blood cell interface, right? And so the tubing here will allow me to see when that red blood cell starts to come up on the tubing, I can stop pulling just before I get any red blood cells up in my syringe. So it allows me to get more pure PRP, okay? So, all the systems that are out there, most of them do the same thing. You can see here, it's another type, it's like a gel separator. So it's a little lab tube or an assay tube. Put the blood in here, spin it in the centrifuge. There's a little gel here that will actually separate the red blood cells, the white blood cells from the plasma, right? So you can actually pull this up and then you get the plasma. So different systems. I have these two syringes here to show you something that's important. So PRPs are not created equal, and that's what causes a lot of the confusion in this field, okay? this system here, these systems that use these tubes like that, they will yield maybe 1 or 2 milliliters or cc's of platelet-rich plasma. This system that I have will yield 7 cc's of platelet-rich plasma, okay, at high concentration, and we're gonna get back to that. So just keep it in your mind, high concentration versus volume, okay, we'll talk about that. So if I have 2 cc's from your sample of blood of actual PRP or rich platelet plasma, if I'm putting into a small space like in your knees or anything like that, 2 cc's is plenty, right? Because that's a small area. Imagine if I had only this to inject all over your scalp, all over your thinning areas. Not enough, right? Doesn't take a rocket scientist to figure that out. If I have 7 cc's, still not quite enough, but then we can cover more area of the scalp with this volume. Now what I do for PRP for the scalp, I actually do 2 of these vials, and so each vial will give me 7 cc's of PRP, so we'll have a total of 14 cc's of actual PRP at high concentration. So good amount of volume, high concentration. So that's what I do here, and I get enough PRP to treat the entire thinning areas of your scalp. All right, so of course, if you have just a little area, we don't have to get 2 tubes, we can get just 1. All right, and you got plenty of blood circulating, so we're not gonna give you anemia or anything from doing this, so it's very safe. Why is that important? So we know from studies done in other applications of PRP, so this is not for hair, but I just use it as an example. The concentration of platelets per volume is extremely important, and that means how many actual platelets you have per milliliter or cc of plasma, right, of rich plasma. So here is different concentrations of platelet-rich plasma, and this is a tissue response up here, right? So the more concentration you have of platelets, the more platelets you have per cc of plasma or PRP, of course, as we expect, the better the tissue response will be. And this can be extrapolated into hair, into damaged knee, into facial healing, into wound healing. You can extrapolate it to anything. So normally what we see is to get a very good response, you want to be somewhere around here, like 5 times baseline. So just to understand how that is. So let's say it's not, but let's say that you have 5 platelets per cc of whole blood circulating in your blood. So for every milliliter that I remove from your blood, we have 5 platelets, right? Of course, a lot more than that, but that's just to keep it simple. In my PRP from your blood, I want to have at least 5 times that many. So I want to concentrate all your platelets into a small volume that I can have 25 platelets per cc or per milliliter or more, right? The more, the better. If I can have 10 times, if I can have 50 platelets in that versus 5, the better the tissue response will be. That's in an ideal world, okay? Most of the devices that are out there to prepare PRP, and there are many out there, they are around 5, some of them will promise 6 times baseline, sometimes 4, sometimes more. So, but that's what they say. Now, my blood, the number of platelets that I have in my blood is different than the number of platelets you have in your blood. There are some health conditions that can actually decrease the number of platelets you have. And if I start with a sample that already has less platelets, even if I multiply that times 10 times, it's going to be a little less than, say, other person's blood that has more platelets. If you look at lab values for platelets, you can Google that. In a normal individual, you will see that there's a range, right? So the more platelets I have circulating in your blood and I concentrate it, of course, I'm going to end up with more platelets in my sample. So what can we infer from this? So the more platelets I can have in my sample, the PRP, the more growth factors I'm going to have, right? It's a direct correlation, and so the better the results will be. And that's where the trick is here. Every one of these devices that provides different volume of fluid, right, and concentration of platelets. So it's very hard to make a consistent study that will create like a recommended or a protocol, right, that we all accept as the true and effective protocol, because there are so many and there's so much variability. Another thing too, let's say I get 1 cc of your blood, and I get a lot of concentration. So we'll go back to this real quick here. So let's say I get 2 milliliters of PRP, right, from this device, for example, or even 14 or 7 milliliters from the device that we use here. And that sample has high concentration. Well, I know that this is not enough for me to treat the entire scalp, correct? I know this is probably not going to be enough for me to treat the entire scalp. So what if, instead of taking another sample of your blood and running 2 tubes versus 1, so I could have twice the volume with high concentration, what if I took saline solution, for example, and then I made this into 14 cc's, but using the same sample? What happens is I'm diluting, right? So I'm adding liquid to that. So now, in every milliliter of this PRP that I have, I've decreased the platelet concentration by half because I'm adding double the volume, but I'm not adding any more platelets. That's another thing too that gets tricky. Some practices, I've seen that done, they get a sample with high concentration, but then to be able to treat the entire scalp, they actually dilute it. When you dilute that, then every little area of your scalp will get a lot less platelets, and then that's when we see sometimes failures of PRP. So treating hair loss with PRP is tricky, to say the least. There are a couple of studies that were called meta-analysis. Meta-analysis is like the best studies you can do, because what you do is you pull a bunch of studies that were done in the subject that you're trying to investigate, and then you get the data and you compile it, and then you draw some conclusions. So a couple of meta-analysis talking about, they pulled all of the studies on hair loss using PRP, and the final conclusion is yes, for the most part, PRP can be helpful to treat hair loss. The problem is, how much is enough, right? In my practice, I'll tell you what I've been doing. I haven't been offering PRP as an option anymore for patients, and if they come to me and request for me to do PRP for their hair loss, I usually don't do it for 2 main reasons. Number one, the results at best can be, they're not going to last very long. So the growth factors don't multiply. They're going to be released in there and everything like that, and they'll go away eventually. So you get a temporary improvement. Worst case scenario, you won't see anything and you spent the money for nothing. It doesn't hurt you though. So there's really no risk, or very little risk, I should say, with PRP, but you may not see any improvements. In my mind, even the patients that saw improvement, they'll have to keep doing it every 6 months, every year, depending. It varies a lot. Nobody knows for sure also how many treatments you need to have. Some people do 1 treatment today, another one in a month, another one in 2 months, another one in 3 months, and then they wait a year. So it's all over the place. There's no consensus, So the patients that I was doing PRP, I wasn't really happy with the money that they were spending with me on that versus the results I was getting, okay? So I stopped offering. Now, if a patient comes to me and say, well, can I use the PRP in conjunction with my transplant, maybe so I can get better healing? Yeah, that's fine, because all those growth factors, they're designed for that. They're designed to heal, right? So if I get some PRP and then I do your transplant and I inject the PRP there right away, they're going to do what they're designed to do. They will see wounds or trauma, right, from the transplant, surgical wounds, and they'll go to work and they'll heal it. So there is a point to be made there, and I know that the PRP can help you heal faster. Doesn't change your final outcome from the transplant, and I make that very clear to my patients, so I don't overpromise anything. But if they still want to do it, I have the equipment here and I do it. But as far as recommending for hair loss, I don't, for those reasons. Again, that's my opinion. If you talk to different people, they will show you the reasons why they like it, show you patients. I don't, because I think that it can be a little bit of a tough thing to discuss with patients. I don't like to offer things that I don't really believe in, and that's the case with the PRP, in my opinion. So how do we expect this to work with hair loss? In an ideal world, you would inject the platelets and the growth factors. They will go to these cells underneath the hair. You put it under the skin, right? And so we know that hair loss, genetic hair loss, and others too, they are triggered by inflammation. We know aging, it's an inflammatory reaction of the body, low-grade inflammation. So we want to fight inflammation as much as we can, right? And so, yeah, platelets have growth factors, anti-inflammatory things, so let's put it in the hair. Maybe we can stop the hair loss or strengthen the hair. But again, like I said before, results can be all over the place. And we're targeting these miniaturizing hairs so that we can maybe make them a little bit thicker, push them into doing better. But again, the results are short, they're not very long lasting. You know, they don't last very long. I prefer to put you on medications, on treatments that I know that can be long lasting, it can be used for a long time. They're very cost effective and safe and effective also. So that's what I had. I hope this was helpful. Again, I get questions about PRP all the time, almost every day. So that's what I tell patients, that's how I approach it. If you've had PRP and you loved it, hey, great, I'm happy for you. But in my practice, I try not to push it too hard, okay? So like the video, hopefully you liked it, so push that like button there. Subscribe to the channel so you can get more updates on more things. And I'll see you next time. Thanks for your time. Bye.